Knock, knock. First, I'm going to start by putting gloves on and washing my hands. Hi, my name is Peyton. I'm going to be your nurse practitioner student today doing your ear, nose, and mouth exam. I'm just going to note your general appearance looks well, your vital signs are stable, so we can move on to the exam. First, I'm going to start by looking at your auricles. I don't notice any swelling masses. They're just a little red, but nothing abnormal there. Next, I'm going to palpate around. Let me know if there's any tenderness.
No.
No tenderness?
No.
Next, I'm going to palpate the maxillary and the tragus. No tenderness?
Right.
Okay. So next we can move on to an auditory exam. I'm going to stand behind you. I'm just going to move my finger in your ear, and I'm going to whisper on this side and tell me what I'm saying.
1, 2, 3.
Good. And then we'll do the same thing on this side.
Repeat it. Hi.
Good. All right. And next we're going to do what they call a Ryan and a Weber test. So I'm going to first place this on top of your head and let me know if you hear the sound in both ears or one ear, okay?
Both ears.
Good. Now I'm going to place this on your bone and then I'm going to bring it into the air. First let me know when you stop hearing the noise and then let me know if you can still hear the noise.
Gone. Yes.
Okay, so bone to air is 2 seconds. Same. I'm going to do the same on this side.
Done. Yes.
Okay, so bone to air is 2 seconds on this side as well. Next, I'm going to inspect the ear. So I'm just going to hold the otoscope. I'm going to pull up on the pinna, and you're going to feel a sharp little poke inside your ear. And I can note that there is no swelling or hemorrhage going on inside of the ear. There's no discharge. There's a little bit of earwax, and the tympanic membrane is gray, pearlish in color. And we can do the same thing on this side. I'm going to pull the ear back a little, back and up, and I'm going to look inside this ear, and I don't notice any swelling. A little bit of no discharge, a little bit of earwax, and the tympanic membrane is gray, pearlish in color. Alright, so next we can move on to your nose. First I'm just going to inspect the nose. It is symmetrical, no deviation noted, no swelling or masses noted. Next I'm going to palpate your nose. Let me know if there's any tenderness.
No.
I'm going to palpate your maxillary and frontal sinuses. Let me know if there's any tenderness.
No.
Good. I'm going to do what they call a translumination of the eyes. So let me look here. Good. And then I'll go up. Good. Alright, and next I'm just going to take a look inside of your nose with this. And I don't notice any swelling or tenderness or swelling or inflammation in the nose. There's no redness. The mucus looks clear. Your septum is not deviated. Alright, and next we're going to move to see if the nasals are patent. So I'm just going to have you close one nostril and then breathe out. Alright, so it's a little clogged up, and then we'll do the same on the other side. And that one's a lot clearer. Okay, and next we're going to move to the mouth. First I'm just going to inspect the lips. And they're pink in color, there's no cracks. The mucus is clear, there's no drainage in that going on. There's no dryness of the lips or anything like that. So I'll have you then stick out your tongue. Move it side to side. Good, there's good movement of the tongue. And now I'm going to look inside of your mouth. So I'm going to open up your mouth and take a look. First I'm going to look at the teeth. And there's no missing teeth. There's no cracks in any of the teeth. There's some caries. So that is it. Next I'm going to look at the soft and the hard palate. And those are pink. And there's no swelling or masses noted on those. Next, I'm going to look at the mucosa, and there is some around Next, I'm going to look at the tonsils, so stick your tongue out for me. I'd use a tongue blade to bring the tongue down. Okay, you can bring your tongue in. And the tonsils are not red or swollen or inflamed. While I was back there, I would also be looking at the pharynx, and that is cleared. It's also not red, inflamed. He's able to swallow completely without any issues there.